Today, bone marrow transplantation is an effective therapy method for hematological diseases which were once considered untreatable. This method is applied by transplanting healthy bone marrow and is now regarded as one of the most promising advances in modern medicine due to its high achievement rate. Bone marrow transplantation is a treatment method with proven successful results. However, the general public has remained largely uninformed. Therefore, many of our patients who start the therapy are skeptical at first due to this lack of awareness. We try to minimize their concerns by explaining the treatment process clearly. The motivation and psychological status of patients during the treatment process is a vital factor contributing to the successful outcome of the treatment. So informing the patients about the process is imperative. Bone marrow is a soft and sponge-like matter containing hematopoietic cells that produce certain subparticles such as red blood cells, white blood cells, and platelets. These subparticles should interact regularly in a healthy human being. Bone marrow transplantation is performed as an efficient treatment method for some diseases leading to pathologies in the blood such as leukemia, lymphoma, and MDS. The procedure, though commonly referred to as bone marrow transplantation, is actually transplantation of stem cells collected from the circulating blood and bone marrow. The most important stage of the process is finding an eligible donor for the transplantation candidate. The treatment starts with tests for a tissue match in an HLA typing laboratory. A tissue match between the patient and his or her siblings is more likely to occur than with other relatives. If a compatible tissue group is not detected, the patient's parents, cousins, and children, if any, are screened for a tissue match. However, a lack of compatible tissue within the family must be accepted as a possibility. In this case, bone marrow banks help us. There are 2 bone marrow banks in Turkey, and donor search may be conducted in one's own country and abroad through these banks. Stem cell collection from the donor is carried out by 2 individual methods. The first is not much different from blood collection. Stem cells are collected by an intravenous access on the arm. The other method is removal of the marrow through a needle inserted into the pelvis. Anesthesia is applied to the donor, and there is no risk except for that possibly involving the anesthesia itself. The marrow is delivered immediately to a hemophysis laboratory after collection. Stem cells are separated from the marrow and placed in a suitable container. The separated stem cells are then frozen and stored at -192 degrees Celsius under sterile conditions in our cryopreservation and stem cell processing laboratory until the time of transplantation. After the stem cells are collected, the patient is prepared for transplantation. Chemotherapy is applied according to the disease type before transplantation because some diseases may require chemotherapy as well as radiotherapy. Such a process lasts about 2 to 8 days. Following the preparation regime, marrow transplantation is performed. The patient should stay in a specially filtered room with a HEPA filter. The patient and his or her companion should not go outside the service area during this process. Visitors are not allowed. The engraftment period is similar to the process of onset of burgeon of a planted seed. This process includes producing blood components of the transplanted bone marrow. The immune system of the patient weakens during this period. Risks for bleeding and infection are higher. It is a long treatment. I stayed in a room purified from germs to avoid infection. I sometimes felt very tired, but I was able to overcome it with the help of nurses and my companion. The companion is very important during this period. The doctors informed me about the sensitivity of the healing process. They told me that a simple flu virus may slow down the process and lead to negative outcomes. We closely follow our patients and help them to endure this process, and also we remain alert for any possible complications later on. We finally set a discharge date when blood analysis values reach a certain level. A medical report, including the details of the progress of the disease, which intervention techniques have been applied during each respective stage, as well as recovery and control processes, is provided to the patient, who then may continue to have therapy in any medical center of his or her choice. I received a detailed medical report and comprehensive discharge training before leaving the hospital. I was informed about the rules to be obeyed at home, the necessary physical setting in which I would live, what food I could eat, and what I could not. Bone marrow transplantation is a technological treatment method, as well as a method that includes long-term and complex processes determined by the diagnosis. Upon referral of the patients to health organizations where they are given a thorough explanation beforehand, procedures are performed by experienced staff and efficient services are provided which, without question, boost the treatment outcomes. Together with improvements in technology and modern medicine, the number of happily ending patient stories increases with every passing day. You may create miracles with your courage, determination, and a healthy dose of hope.